Welcome to this video series entitled Innovations in Diagnostic and Pharmaceutical Technology, focused on research materials and their applications, brought to you by Pentapharm. This video will review the protease inhibitor Aprotinin. Aprotinin is a single-chain polypeptide of 58 amino acid residues. It is a broad-spectrum serine protease inhibitor of multiple proteolytic enzymes, specifically trypsin or chymotrypsin-like proteases. Aprotinin also has anti-inflammatory properties. Aprotinin is also known as a basic pancreatic trypsin inhibitor, or BPTI, or as a trypsin-kallikrein inhibitor. Basic pancreatic trypsin can be found in several organs, including the liver, spleen, pancreas, and lungs. The term aprotinin is typically used for BPTI derived from bovine lung. Free aprotinin is detectable in calf serum. This figure shows the structure of aprotinin. The tertiary structure is a pear-shaped unit which fits into the active site of several serine proteases. Its active center is formed by 4 lysine groups, and the unique structure, stabilized by 3 disulfide bonds, is responsible for its high stability and remarkable resistance to elevated temperatures, acids, and proteases. Aprotinin has an isoelectric point of pH 10.5. 3 types of aprotinin are currently available, which are bovine lung-derived, recombinant, and synthetic aprotinin. Pentapharm's bovine lung-derived product is available as an active pharmaceutical ingredient, but it also has applications in laboratory use. Recombinant and synthetic aprotinin are sequenced like the bovine form, but are not available as active pharmaceutical ingredients. In considering specificity and activity, note that aprotinin inhibits serine proteases with various physiological functions. Important typical proteases inhibited by aprotinin include trypsin, chymotrypsin, kallikreins, and plasmin. Aprotinin also weakly inhibits the plasminogen activators TPA or UPA, acrosin, which is essential for conception, human leukocyte elastase, which plays a role in inflammation, and activated protein C, which is involved in thrombosis. This table shows the relative function, as measured by kallikrein inhibitor units, of aprotinin with different types of proteases. Aprotinin can be considered a universal inhibitor, as it has multiple enzymatic targets. Other proteases and peptidases that are inhibited by aprotinin include dipeptidyl peptidase 3, transmembrane serine protease 2, outer membrane proteases of the Omptin family, including gram-negative bacteria, and H1N1V influenza virus protease. Dipeptidyl peptidase 3 is a cytosolic metallopeptidase in the renin-angiotensin system that is involved with blood pressure regulation and oxidative stress regulation. Transmembrane serine protease 2 is involved in the activation and cleavage of the epithelial sodium channel and in the activation of the SARS-CoV-2 spike protein. Indirectly, aprotinin can prevent activation of other proteases, such as matrix metalloproteinases, or MMPs, by plasmin. This is important to note because MMPs, including collagenases, are involved in several physiological processes that impact human health and disease. Aprotinin is a competitive protease inhibitor. It forms a stable, non-covalent complex with serine proteases and blocks their active centers in a reversible manner. Aprotinin binding to serine proteases can be reversed in alkaline or pH 10 and acid environments. Acid environments in which the binding can be reversed are pH 5 for most proteases and pH less than 3 for trypsin and plasmin. At these extreme pH values, it is possible to separate aprotinin from the protease by chromatography on a molecular sieve column or by filter dialysis. Aprotinin is only cleaved slowly by most proteases, if at all. Let's explore how aprotinin works. This diagram illustrates the mechanism of action with the red figure representing aprotinin. It binds firmly to the active site of proteases, thereby blocking the access to its protein substrates and subsequent cleavage of protein substrates by proteases. The reactivity of aprotinin against multiple proteases from various sources and with several specificities makes it a universal scavenger for labile proteins. Aprotinin is soluble in water, in aqueous buffers of low ionic strengths at pH values of 1 to 12. It is stable against denaturation due to high temperature, pH, organic solvents, or proteolytic degradation. Sterilization may be achieved by filtration through a 0.2 micron filter. Aprotinin has several applications in life sciences. In addition to its use as a pharmaceutical agent, aprotinin can be used for protection of proteins and enzymes during isolation and downstream purification, purification of serine proteases on immobilized aprotinin or affinity chromatography, sample collection to prevent proteolytic degradation of labile proteins, improving bioassay specificity by avoiding nonspecific proteolysis or cleavage of synthetic substrates, and for detection and quantification of kallikrein-like activity in mixtures of proteases including contamination in blood products or plasma fractions such as immunoglobulins or albumin. Aprotinin is used for both pharmaceutical bioassays and for diagnostics. As a diagnostic agent, it can be used to identify potential contamination of biologicals with serine proteases, such as kallikrein-like activity in cell culture, and plasma fractions factor concentrates. Increasing the aprotinin dose does not affect the proteases that are inhibited by aprotinin. When used for assays, aprotinin can increase specificity. It protects proteins involved in the assay, such as labile coagulation factors or fibrinogen, and prevents unspecific cleavage of synthetic peptide substrates in chromogenic, amperometric, fluorogenic, or luminogenic assays by contaminating proteases or their complexes with alpha-2 macroglobulin. Aprotinin can also protect proteins measured in immunoassays against proteolysis, thus maintaining their integrity. Another application of aprotinin is to stabilize labile recombinant proteins during cell culture or downstream purification. Some recombinant proteins that it can stabilize are listed here, including coagulation factor 8, TPA mutant GK1L, and others. When used for affinity chromatography, immobilized aprotinin covalently coupled to agarose beads can remove or isolate serine proteases from body fluids, cell or tissue lysate, either in column or batch processes. The binding of aprotinin to proteases is reversible with dissociation of aprotinin protease complex at pH less than 3 or pH greater than 10. Examples of this application include purification of the prostasin from human seminal fluid and partial purification of chymotrypsin-like enzyme from culture medium of epithelial cells of human skin, human gingiva, and porcine periodontal ligament. Aprotinin is used in cell culture media to inhibit degradation of proteohormones, cytokines, or other important proteins. It can also extend the lifespan of certain cells in culture. In animal experiments, aprotinin injection into lab animals may allow characterization of biochemical pathways which are subject to proteolysis. Aprotinin can also be used for ultrasensitive detection of proteases after SDS electrophoresis on nitrocellulose blots with avidin alkaline phosphatase. The biotinylated aprotinin detection system can detect as little as 0.2 nanograms or 8.5 femtomoles of active proteinase such as trypsin. Specific irreversible chloromethyl ketone proteinase inhibitors used in combination with this detection system enabled respective proteinases to be selectively inactivated and thus positively identified. Examples of enzymes that can be detected include neutrophil elastase, cathepsin G, pancreatic trypsin, chymotrypsin, and plasmin. Lastly, aprotinin is used as a pharmaceutical agent. It can reduce the risk of perioperative blood loss and the need for blood transfusion in patients who are at high risk during coronary artery bypass graft surgery. Aprotinin prevents fibrinolysis and can be used in fibrin sealant to delay the fibrinolytic action of plasmin and to stabilize the fibrinogen and factor 13 components. It also preserves platelet function and has anti-inflammatory effects, mediated by inhibition of protease-activated receptors expressed on platelets, vascular endothelium, and neutrophils. Also, aprotinin prevents entry of viruses such as SARS-CoV or influenza, into cells by inhibiting the proteolytic steps required for entry. Thank you for watching this brief overview of the structure, mechanisms of action, and applications for the use of aprotinin.